So I'm Grace Redhead. I have been working with this archive since about 2017 when I was doing my PhD on the history of sickle cell in Britain. I went to the Sickle Cell Society to ask them if they had archives, and they had this incredibly rich files and reams of amazing documents. And I spoke to John James, the CEO of the Sickle Cell Society, and he was really passionate about the history of the Sickle Cell Society being recorded for everybody and collected for everybody to look at. And that's then when I met Alinta.
So my name is Alinta. I came on board on the project in 2019. I worked as a project lead for the Sickle Cell Society. So the Sickle Cell Society received a grant from the HLF to look at the history of sickle cell in the UK and also the history of the Sickle Society. And part of the project was to look at the archive and to donate the archive to the collection, collect oral history. So we've worked with Grace on the project from 2019 to 2021. And so we've been looking regularly, almost weekly, at the archives.
The archive is so rich in terms of how the society is a mixture of families, patients, nurses, all together at this time trying to figure out what is sickle cell disease, what are the important things that people need when they're living with the illness.
When I was looking at the archives, like especially the leaflet, the initial leaflet, where there were a lot of aspects of the leaflet were about also the social aspect of living with sickle cell. So like the focus on what it is in terms of society, what do people need in terms of housing. So it was really within the community, and it came across from the leaflet, and also the fact that they were obviously translated in different languages, so acknowledging like the population, the variety of the population affected by sickle cell. It was good looking at the archive and interviewing people to see the connections, because it gives life to those stories, because we interview a big part of people that actually were, that we knew their faces, or we saw their faces in the Sickle Society newsletter or photograph. So as you said, it's really like a community of patients, of people. It's not like a corporate organization. It's like there is a history there, and I guess that's for something that comes, as you say, a lot in the newsletter, is like the poetry, the art, like a lot of artists, poets, photographs. So from the community, I think that inspired a lot of the activities we did as well around the archives.
Lots of the art, I think even the logo was designed by a patient.
Yeah.
At least the first logo. Lots of the kind of art on the front of the publications. Bike ride was a man whose daughter had sickle cell, and then he died sadly of an asthma attack.
Mm-hmm.
And then they ran this kind of memorial bike ride, and there's so many amazing pictures in the archive of like people having a great time in Brighton, eating curry and like with big posters and stuff, all boating, sending them off.
I think it's go back to what we were saying. I feel like the earlier logo looked like more that like an organization that is rooted into the community, but also like black community, like black radicalism, and it shifted to something a bit more, I feel, kind of corporate, like not corporate, but neutral, I would say. So yeah, and I remember that with some of the leaflet, because the date wasn't there, so we had to look at the logo, just like to be able to date them.
Some of the images in this book, for example, are drawn by patients, and they're so like evocative of like, I guess, one person's kind of world and experience. But it's a publication that's aimed at like really at nurses and healthcare professionals, and they've got this kind of patient art which feels like kind of remarkable for the time.
Yeah, what transpires from the archive is like all the tools they were having to raise greater awareness, the creativity, and how they had to find creative way to raise awareness with the little mean they had. So it's really impressive as well. All the things they were able to publish, all the things they were able to do, knowing that probably didn't have that much funding, and also what goes into the, like we saw in the archive, is like the celebrities involved, or the key personality like Florida Benjamin, Lenny Henry, and how they've been all gathering to help. And I remember that's what Professor Dame Elizabeth Daniel was saying, like, how they were trying to find ways, and people rallying and helping.
Yeah, and you can see in so many of the newsletters that they're like, here they're talking about the Black on Black Sickle Cell Society blood donation campaign on Channel 4, and they're using contacts in like what is like quite a white dominated media industry. They're trying to break through and trying to raise awareness despite everything, despite like people not really listening.
Yeah.
It is like such, when you look at it, you're like, God, they did so much in like quite a short space of time with quite little resources, really.
Yeah. I guess sometimes I was thinking, nowadays you would say, you have a marketing person or, someone thinking in strategy and hire just for that, and having this not agenda, but like, how they should do. And it was kind of, they already had it.
Yeah, and I think like that's something about it being in an archive now. We were kind of saying, an archive maybe makes it seem like it's a settled history in some way, or like, but actually, like it's in the past, or maybe that's how we think of archives, but when you actually look at and read some of the stories that come out from like the newsletters and some of the quotations from patients talking about their experience, like it's so similar to the things that people would say to us at events and that people reported in interviews, and it's like still extremely live and still, like, though the society and all the other organisations have done so much, the question of racism and discrimination in the NHS against people with sickle cell disease is not a settled one.
No. Yeah, and I remember when I was still working for the Sickle Society, we were about to finish the project. They had, with the whole parliamentary group, they had a project where they were interviewing patients, and I was like, oh, but we have interviews from the project and we have the archive. And so they were showing, like, how the NHS again was failing patients, but it was the same story. So the story in 2021 were the same that what the patient were telling us or what the archive was saying in the 80s, So although there are improvements in terms of like access to care or new treatments, but the same stories come back.
Mm-hmm.
And I think it was around that time that there was the result of the inquest, like the 2019 young man that died. Died of sickle cell, of a crisis in a hospital in London.
Yeah, and I think that's why I remember John James, the CEO, talking to us about why he wanted to sort of do a historical heritage project about the society, was because it really was such a I guess that this generation of people like lived through some dramatic changes and going from kind of total ignorance about in the NHS about the illness and contending with like, you know, so much racism and also an illness that was really poorly understood or like described in medical literature until really, really recently.
And not, I remember he was saying also there wasn't like, you know, even it's quite like there wasn't that many treatments. It's really slow, you know, and it's due to you know, lack of funding and because the research is mostly public research, so not they can necessarily. I mean, it's changing by by the pharmaceutical industry, so it's quite slow. So it's neglected in that way as well.
But and that's so much, I guess, shapes like what the society is, because Oscar starts out as this organisation for sickle cell anemia research, and then some of them start to say relief, because sort of trying to research this trying to do any kind of raise money for genetic research is so expensive. It's kind of not an option for like a sort of patient-run group. And so there's a big pivot, I think, to the social support and like advocacy. Yeah, and you can see like kind of often in the newsletters in particular, there's kind of new hopes, or a hope of a new treatment, or a hope, like the promise of a new treatment comes through, and then often doesn't pan out. And some of the people that we spoke to kind of said, you know, kind of feels like there's a new drug or a new treatment like basically every 20 years, and but it's extremely slow.
Yeah, it's really slow. There is more research to be done around, like, you know, maybe sickle cell and the like not everyone is the same, and I think that's not, you know, taken into account also in terms of medical research. Yeah, it's always the I guess the dichotomy even for patients, because they are invisible within the system. No one really cares, or they are not really seen, but at the same time they are discriminated because they are visible. So because they are perceived as, you know, so yeah, it's always the issue within the NHS, and I guess also what also, you know, like, you know, I feel that the frustration sometimes, like, it's like those archives are so important, and when you look at it, so many things has been done. Its work is amazing, and my question after the project and going through the archives is like, why there's still so much little awareness when it's not that they're not doing the work. So where does the problem come from?
Yeah, and I guess like what's really important as well to the work is that nurses are doing it. You can see nurses using the society as a voice to stand back and criticise the NHS, like in publications like this. And so these people are in the NHS, and they're trying to work to change things, and you can see that they have success. But in the newsletters, a lot of the time you see there's a success and then there's a closure, or like, especially now, some of the specialised sickle cell services, which hold so much expertise in terms of how the illness should be treated, are being closed, or being incorporated into bigger services, and that expertise is lost. And that's, I guess, it kind of really, it's not a like sort of story of straightforward progress.
And it's still relevant today when you look at it, when you think about the state of the NHS and the healthcare system. It makes, you know, so yeah. So yeah, It's I think that's what I like about archives in general, and those archives is the conversation between the past and the present. It's an ongoing conversation, and it makes you reflect about the society, today's society. So I guess that's why I would like researchers or people to take from the archives. It's really relatable.